Today, I'd like to talk about the clinical evidence and safety of electronic moxibustion and thread embedding acupuncture as one of the modernizations of Korean medical health technology, focusing on the clinical trials that I've conducted and the ongoing research. Prior to the presentation, I declare no potential conflict of interest with respect to the research. I'm a professor at Sangju University and Vice President of Industry Academic Cooperation, R&DB Foundation, and the Academic Director of KAMMS. Today, firstly, regarding electronic moxibustion, I will introduce the confirmative multi-center randomized controlled trial using traditional moxibustion and electronic moxibustion for cancer-related fatigue and the safety assessment of the other two clinical trials using electronic moxibustion only, and the results of the additional systematic review comparing traditional moxibustion and electronic moxibustion. And secondly, regarding electronic thread embedding acupuncture, I will briefly introduce the research that I'm currently conducting on the safety of thread embedding acupuncture. As you know, moxibustion is one of the representative Korean medical treatment widely used to prevent and treat various diseases through thermal and chemical stimulation on skin tissue by burning moxa. As you can see in the slide, traditional moxibustion comes in various sizes and shapes and utilize various objects or moxibustion devices. Many large-scale clinical trials and systematic reviews, meta-analysis show that moxibustion is effective for a wide range of health conditions. However, despite the therapeutic effect, moxibustion has several weaknesses. Harmful gases generated during the combustion process, so ventilation is needed to remove the smoke and odor from moxibustion combustion to reduce complications such as dizziness, coughing, dry throat, and headache. Furthermore, it is difficult to precisely control the magnitude of thermal stimulation, side effects such as burns, pain, skin scar, and secondary infection, etc. can be caused like this. Therefore, electronic moxibustion has been recently developed to overcome the limitation of the traditional moxibustion and can stimulate the skin with a relatively constant temperature via electronically produced heat, alleviating burns, smoke, and odor. Generally, electronic moxibustion is made up of two parts in this slide, the heating units and the charging equipment. Although there are some differences depending on the devices in general, electronic moxibustion is operated as shown in this slide. And also as shown in this graph and table, the temperature change proceeds with a stabilizing period of approximately 2 to 3 minutes, followed by temperature maintenance period of 8 to 10 minutes, and a temperature descending period of 2 minutes. The structure of the electronic moxibustion is as shown in this slide. A lithium-ion battery and connecting terminal are included inside the heating unit, enabling charging through electrical energy. By pressing the switch located on the top of the heating unit, thermal stimulation is transferred to the plate on contact with the skin. And you might be wondering whether there will be a difference in the temperature change pattern of electronic moxibustion compared to traditional moxibustion. Previous research reported that traditional indirect moxibustion resulted in a higher temperature rise compared to the electronic moxibustion at the surface and at a 2 mm depth reaching over 50 degrees Celsius, which create a risk of burns. Thermal stimulation with electronic moxibustion had a lower risk of burns with temperature increment not being statistically different from traditional indirect maximization below the depth of 5 mm. Furthermore, after reaching its peak surface temperature, a rapid decrease was observed with thermal stimulation from traditional indirect maximization, whereas electrical maximization showed a gradual decrease after maintaining the surface temperature between 40 to 45 degrees Celsius for a long period. This may indicate a possible therapeutic benefits of electronic maximization. However, they are the results conducted in a laboratory setting, and further clinical research is needed in the future. So our research team conducted several clinical trials to evaluate the effectiveness and safety of maximization, including electronic maximization in actual clinical setting. Among these clinical research, I will introduce a confirmative multicenter randomized controlled trial to evaluate the effectiveness and safety of maximization for cancer-related fatigue patients. In the pilot feasibility study, we used commercial traditional indirect maximization that was widely used in the treatment of cancer patients at the time. However, this traditional indirect maximization actually had large variation in temperature and heat transfer, making it difficult to consistently control it and apply a sham device in clinical research. So we changed the maximization devices applying to the confirmative multicenter randomized controlled trial. A total of 96 patients with continuous fatigue related to cancer treatment or cancer itself for at least 4 weeks. Fulfillment of the ICD-10-CM diagnostic criteria for cancer-related fatigue and 4 and higher points in a BFI score were recruited from 3 University Korea Medical Hospital and randomly assigned to maximization group and sham maximization group or usual care group. Both the maximization group and the sham group received maximization treatment for 8 weeks, and the usual care group did not and maintained their usual treatment and self-care. BFI score and functional assessment of cancer therapy fatigue score were used to assess cancer-related fatigue. In this trial, 2 types of maximization were used as shown in this slide. 2 medium-sized traditional indirect maximization were applied on the abdomen area, CV8 and CV12, and 4 electronic maximizations attached at LI4 and ST36 bilaterally. The sham maximization devices were designed to exclude the therapeutic effect while maintaining blinding as much as possible. The appearance of the sham traditional indirect maximization and electronic maximization were exactly identical to those of the verum maximization. The patients were able to see the practitioner ignite the mugwort and the traditional indirect maximization with a small amount of smoke and burning odor applied on their abdomen. In the case of electronic maximization, the patients were able to see that the electronic maximization attached on their skin and turned on as the light on the top of the electronic maximization began to blink. These procedures were same as the mentioned used for the maximization group. However, the base of the sham traditional indirect maximization was filled with an insulator to block heat, and the heat sensor in the electronic part of the base of the sham electronic maximization was controlled to block heat transfer. While developing the sham device and conducting clinical trial, we conducted numerous tests to properly control the actual temperature of maximization and implement it on human skin. We confirmed that the temperature rose to 43 to 45 degrees Celsius during the real electronic moxibustion treatment, thus making the participants feel slightly warm on the skin. However, the temperature did not sufficiently rise to stimulate the acupoint. The patients of the the patent of this apparatus for sham moxibustion has been applied for and registered. The actual skin temperature applied electronic moxibustion is affected by many factors, so caution is required. The results showed that BFI score significantly decreased in moxibustion group compared to the usual care group. Although the sham group also showed significant improvement during the treatment period, only the moxibustion group showed improvement after 4 weeks of follow-up period. After the intervention, the questionnaire was administered to confirm if the blinding was appropriate for the sham moxibustion group. Blinding test showed no statistical differences between the two groups, and the present findings showed that blinding was well maintained throughout this trial. Our finding confirmed that moxibustion is effective and safe treatment for cancer-related fatigue, and also has a prolonged treatment effect after the end of treatment. These results were published in Cancer Medicine Journal. And for safety assessment, blood pressure and body temperature was evaluated at every visit, while adverse events and continuously monitored throughout the study. The laboratory test was done at the baseline and week 9 to confirm participants' safety. There were no significant differences in vital sign and blood analysis, and no serious adverse events occurred throughout the study. 9 patients in the moxibustion group and 11 patients in the sham moxibustion group and 1 participant in the usual care group reported minor adverse events. The most common adverse events were dyspepsia and upper respiratory infection, although most adverse events were unrelated to the intervention. 2 participants in the moxibustion group reported mild burns at the moxibustion site. Mild burns were managed with adequate dressing and a burn ointment. Moreover, in the other 2 clinical trials conducted by our research team using electronic moxibustion alone, mild adverse events including redness were reported as shown in the slide. Therefore, I carried out a systematic review and meta-analysis to confirm the current evidence for several questions on the effectiveness and safety of electronic moxibustion. I searched core DB, including Web of Science, Medline via PubMed, and domestic DB, including WASH's Journal of Acupuncture Research and CNKI. A total of 336 studies related to electronic moxibustion was identified, and 81 clinical studies using electronic moxibustion treatment were included. The publication trend of electronic moxibustion studies by year is as shown in the figure. Firstly, looking at the disease group with a focus on the annual trend, disease in the musculoskeletal system still account for a high share, followed by digestive system, cancer-related symptoms management, psychiatric, OBGYN, post-stroke related symptoms, respiratory, urogenital, circulatory system, etc. This trend is similar to the moxibustion research trend over the past 20 years, and electronic moxibustion can actually be applied in accordance with traditional moxibustion. Second, among the 81 papers, there are 6 studies comparing electronic moxibustion and traditional moxibustion, and all of them evaluate the effectiveness and safety of electronic moxibustion for knee OA, knee osteoarthritis. Both electronic maxibustion and traditional maxibustion were effective for knee osteoarthritis, and these were no significant statistical differences between electronic maxibustion and traditional maxibustion. Answer: is electronic maxibustion safe, or does electronic maxibustion cause fewer adverse events than traditional maxibustion? And among the 7 studies comparing electronic maxibustion and traditional maxibustion, 3 studies reported adverse events. In the electronic maxibustion group, 4 out of 146 patients reported adverse events, and in the traditional maxibustion group, 10 out of 146 patients reported adverse reactions, which were not statistically significant. When analyzing the number of adverse events, 7 cases were reported in the electronic maxibustion group, and 10 cases were reported in the traditional maxibustion group. And types of adverse events included redness, blister, crust, and tingling. In 3 studies comparing electronic maxibustion and sham electronic maxibustion, a total of 3 cases of redness to the applied site and 1 cases each of pain and dizziness were reported in the electronic maxibustion group. So before use, fully understand the characteristics of each electronic maxibustion devices, and to remember that there is a risk of lower temperature burns, and be careful when using electronic maxibustion continuously on the same area. And be careful when using electronic maxibustion on children or delicate skin such as the face or eyelid. And during the procedure, tell the following as: if you feel hot or don't hold back and tell me. And actually, in the clinical trial, to prevent burns, the attached site was adjusted within 1 centimeter of acupoints or by lifting the electronic maxibustion device to adjust the degree of thermal stimulation only when the subject complains of excessive heat. And to the next, regarding thread embedding acupuncture, I will briefly introduce the research that I'm currently conducting on the safety of thread embedding acupuncture. As you already know, TEA is an acupuncture therapy used to treat various conditions and diseases by inserting medical thread into acupoints for continuous stimulation. Various materials such as chromic catgut, polyglycolic acid, and polydioxanone were used for thread embedding acupuncture in various countries. The safety of PDO, polydioxanone, has been demonstrated, and the PDO monofilament thread is widely used in the public of Korea. In the previous research, to investigate what significant change occur in the tissue over time when a PDO thread is inserted. PDO suture case cause specific changes to the surrounding tissue that result in neocollagenesis, a fibrous merging effect, fat reduction, and tissue contracture, and an improvement vascular environment. The results of this study may explain the positive changes described in many clinical research. However, in some cases of 48 weeks, and in some cases of foreign body granuloma was observed. The author described that even observable thread injection can cause unwanted nodules due to foreign body reactions. In addition to common adverse events such as redness, swelling, bleeding, and pain in clinical practice, there has been reports of potential complications such as dimple symptoms, hair loss, and various inflammation. As shown in this picture, 2 years post-operatively, the threads are quite visible, and the thread removed from the forehead and the bubbles barbs were still intact on the thread. So our research team is conducting research to collect safety data, including various adverse events after thread embedding acupuncture treatment, and to establish the evidence for safety of TEA. We conducted a Delphi study to develop the safety information survey items for TEA involving multidisciplinary experts. And we developed a standardized form that allows medical staff and patients to report all adverse events that occur after TEA and established a system that allows patients to conveniently report using an application at any time. A pilot prospective multicenter observational study on the safety of TEA was conducted at 2 University Korean Medical Hospitals in Korea with IRB approval and has been completed. As a result, from the total of 100 patients for 6 months in the pilot study, only mild adverse reactions were reported in a total of 7 patients. Based on the result of the pilot study, we are subsequently conducting a multicenter safety study targeting 350 patients and more than 800 cases at a total of 5 medical sites. The result of this study will establish evidence for the safety of thread embedding acupuncture and help Korean medical doctors use TEA more safely and effectively in the future. Thank you for your attention. And 그리고 저희 연구에 참여해주신 그 모든 환자분들과 그리고 3D에 굉장히 많은 노동력과 에너지가 들어가는 다기관 임상 연구에 참여해주신 강동 경희대병원을 포함하고 경희의료원 그리고 부산대학교 한방병원을 포함한 모든 의료진과 연구 책임자 분들께 진심으로 감사의 말씀을 전합니다.